Okay, let's just get straight into it. Welcome to this explainer. Look, if you're tuning in, there's a really good chance you already know the deep frustration, the anxiety, and, let's be totally honest here, the massive blow to your self-confidence that comes with missing teeth and failing dental health. And right out of the gate, I just want to validate that. It is incredibly stressful. You're looking for a high-end, reliable solution to get your smile back, and you want to understand exactly how the science and the finances behind it all actually work.
Because, wow, $2,500 to $4,000, that's the typical cost for just one single premium dental implant in the UK or the US. Think about that for a second. That is literally the price of a decent used car for one single tooth. It's a staggering figure, and honestly, it creates this massive financial brick wall that forces so many patients to just compromise on their health. So today, we're diving into the data from the Estesie Dental Clinic guide to pull back the curtain on why that number is so incredibly high, and more importantly, what your actual alternatives are.
So here's our roadmap for today's explainer. We're going to cover 1. The UK dental crisis, 2. The Swiss gold standard, 3. Decoding the hidden costs, 4. The Istanbul advantage, and finally, 5. Your 4-step surgical journey.
Let's kick things off with part 1, the UK dental crisis.
Right now, patients are completely caught in the trap. On the public care side, like the NHS, the system is fundamentally buckling. We're actually seeing these domestic dental deserts where people can't even register as a patient. The wait times are just massive, and the focus is purely on basic functional needs, like giving you standard acrylic dentures, which, by the way, don't even stop your jawbone from shrinking. But then on the flip side, you have private care. The clinical standard there is undeniably high, sure, but the costs, they are entirely prohibitive because of these wildly inflated domestic overheads. So you're basically stuck between a system you literally can't access and a system you simply can't afford. And honestly, this exact dilemma is exactly what's pushing discerning patients to look abroad.
Which brings us to section 2, the Swiss gold standard. Now, to really understand premium implants, you have to wrap your head around this one specific term, osseointegration. Okay, so what is that? It's the biological process where your living bone structurally and functionally connects to the surface of an artificial implant. Conceptually, think of it like a dry sponge soaking up water. Your living bone cells literally grow right into the microscopic pores of the titanium, becoming one single solid unit with your jaw. This biological bond is absolutely crucial. It's the foundation for any successful implant. And when we talk about the absolute gold standard for making this happen, we're talking about Straumann. They're a globally recognized research powerhouse based right out of Basel, Switzerland.
And when you put their materials side by side with the traditional stuff, it is crystal clear why Straumann is the absolute apex of dental implantology. Look, the traditional standard is just commercially pure titanium. It's got standard strength and usually requires a pretty lengthy 3 to 6 month healing period. But Straumann? They developed something totally revolutionary. Their Roxolid and SLActive technologies. Roxolid is this unique alloy made of 85% titanium and 15% zirconium. It has exceptionally high tensile strength, and this is a total game changer because its immense strength frequently eliminates the need for invasive, painful bone grafting. Surgeons can literally just use a smaller, stronger implant. And on top of that, their SLActive surface is chemically active to attract blood and proteins. That accelerates the whole osseointegration healing process from months down to just 3 to 4 weeks. It's wild, but it's absolutely true.
Moving right along to section 3, decoding the hidden costs. All right, get ready for some radical transparency here. Using data straight from the Estesie Dental Clinic guide, we are completely pulling back the curtain on the actual business-to-business raw hardware costs of a premium single-tooth restoration. Let's look at the components. The actual Swiss-engineered implant fixture, the screw that actually integrates into your bone, costs between 220 and 350 pounds. The healing abutment, 25 to 50 pounds. The digital scan body they use for 3D modeling is 40 to 70 pounds. The Vario base, which bonds the crown, is 45 to 85 pounds. And that little prosthetic screw is just 12 to 25 pounds. So when you actually add all of that up, your baseline hardware cost is sitting between 342 and 580 pounds. That is the actual cost for the physical world-class materials. Now remember that $4,000 figure we talked about at the start? The massive gap between those two numbers is purely domestic overhead. You aren't just paying for a premium implant anymore, you are paying to keep the clinic's lights on in some high-rent city. Let's jump into section 4, the Istanbul advantage.
Let's compare these operational structures directly, because this is where things get really interesting. In the UK and the US, your dental bill is basically subsidizing astronomical commercial rent in places like London or New York, incredibly expensive domestic dental labs, and soaring malpractice insurance. But look at the overheads in Istanbul. They benefit from significantly lower real estate costs, they utilize advanced in-house digital labs, and they operate with highly favorable currency exchange rates. The core takeaway here? Patients traveling to Turkey are paying for pure clinical excellence and authentic, globally warranted Straumann materials. They are not paying for Western administrative bloat.
And the bottom line on this is honestly staggering. Istanbul clinics, like Estesie Dental Clinic, which serves as our transparent case study here, are typically 60 to 75% more cost-effective than identical private treatments in the UK or US. Let that sink in. You get the exact same premium Swiss engineering, placed by top-tier maxillofacial surgeons, but all those structural savings of the Turkish medical ecosystem, they're passed directly to you, the patient.
Which brings us to our final section, your 4-step surgical journey.
So how does this actually work in practice? Well, the modern workflow is incredibly precise. Step 1 is entirely digital, 3D CBCT diagnostics and planning. Before a scalpel is ever even lifted, the surgeon maps your jaw digitally to figure out the exact angle and depth, completely minimizing human error. Step 2 is the surgical placement of the fixture itself. This is done under profound local anesthesia, so it's completely painless, and honestly, it usually takes just 20 to 30 minutes. Step 3 is that vital osseointegration healing phase we were talking about earlier. And don't worry, during this time, you're fitted with a temporary restoration, so you never have to walk around with a gap in your smile. Finally, step 4 is the placement of your final, precision-milled ceramic crown, which is perfectly color-matched to your natural teeth. Of course, to go on this journey, you do need to be the right candidate. Ideal candidates need a healthy jawbone density, though as we learned, Straumann's Roxolid material makes that a whole lot easier, or at least a willingness to undergo bone grafting if needed. You also need managed systemic health, like controlled blood pressure or diabetes. You absolutely have to commit to meticulous long-term oral hygiene to protect your investment. And a special note here, this is the big one, you must commit to quitting smoking and heavy tobacco use. Smoking constricts your blood vessels, which heavily restricts oxygen flow to your gums. That directly starves that delicate cellular healing process and ruins that sponge-like bone integration we talked about. So, no smoking.
All right, so we've broken down the Swiss science, those hidden domestic markups, and the macroeconomic advantages of seeking care abroad. Which leaves us with one final thought for you to consider. Armed with all this newly revealed financial and clinical transparency, is it time to stop compromising on your smile and start demanding clinical excellence without the inflated price tag? The choice is entirely yours, but now you actually have the data to make an empowered decision. Thank you so much for joining me for this explainer, and I'll catch you on the next one.